views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and their respective stations.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome to Bobo 89.1 FM. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And this month, I want to say it's our time. And I say that jokingly, but we really get together and talk about men's health issues this month. And it's really gotten to the point that we have to have these conversations. We live in the Caribbean, and I hate to tell it, you guys need to go and check in at least once a year, maybe every 6 months if you're on the spectrum, because there are things that we need to take care of when it comes to our men's health. And I have a round table of gentlemen here talking to me. Go ahead and introduce yourselves.
Hi, I'm Dr. Murthy. I'm the radiologist at HSA.
Hi, I'm Dr. Jyoti, pathologist at the HSA.
I'm Dr. Eleweanya. I'm urgent care general practitioner at HSA.
I am Dr. Shillingford, also a general practitioner working at the urgent care department, also at the HSA.
Thank you so much for being on the show today. And we're going to be talking about all things really relating to prostate, relating to cancers with men. We generally have a tendency to wait till something happens and then deal with it rather than being proactive, kind of prepping our bodies, prepping our minds, and also prepping our families for things that, once we hit a certain age, there are things that they need to remind us about and also check. We have a high level of salt and obesity in our community and things of that nature. So, men, let's dive into it. What are some of the most common health issues dealing with men in our region today?
Right, so this is Dr. Shillingford again. There are many health issues that a man should be looking at, and I'm happy that you mentioned certain age, but we don't want to forget that everyone of any age needs to have certain health issues looked after regularly. And one thing I always say is that men's issues, generally speaking, are person issues. Everything that a man, there are many things that a man needs to look after that are not specific to men. You have to look after your blood pressure, for example. We need to make sure that you're not increasing your chances of getting heart disease, for example, and diabetes and all of those things, which apply to both men and women. So as you said as well, it's important. In the Caribbean, it is very difficult to get men to come and see their doctor regularly. It is important that us as men make time to go and see a doctor regularly to check not just the men's issues, but all of the health issues that we all should be seeing, both men and women. But to answer your question specifically, there are certain things that apply mostly to men. Women don't have a prostate, so we tend to have a bigger conversation about prostate cancer with the men. There are other things that men need to look after as well. Our hormone levels decrease as we get older, as Dr. Obinna could probably tell you a bit more about as you get older. But there are lots of things, like I said, that we need to speak to you regularly as a man. So the important thing is not to look after one specific thing, but to make sure, as you say, that you see your family physician or your general practitioner, or whoever it is, you have a regular doctor, regular checkups to make sure that all of those things are looked after.
One of the things I definitely want to talk about and ask the doctors, I mean, we have a tendency to want to be the head of the household. We're driving our families here and we're sitting in on things like that. Is there a certain level that we need to say, okay, you know what, we need to know what our blood pressure is. We need to be on point with our family members' low sodium intake. Talk to me a little bit about that.
Yes, being the man of the house. I mean, in the Caribbean, men tend to say we are the man of the house. That puts you at a very important part, as a very important member of the family. Your family looks up to you, and so they actually look up to you in terms of their general lifestyle. And so it's always good to be the one directing how the family actually, from their diet, habit, and it is also good for men to introduce other things like activities, physical activities, and of course decide on some other factors that we now know we generally call our lifestyle. So the diet is important, physical activity is important, but for men, I always advise them, the first thing that every man must look out for as they are getting older is to check on their blood pressure, and from time to time, like Dr. Shillingford said, they should go to the hospital and look at whether they have anything that is changing in their sugar, to prick themselves, or at least if they go to hospital, they'll be checked, to look at their urine. And then as they're getting older, we now realize that there are other issues that may come on, which is their prostate. There is something that relates to men a lot, which comes as a consequence of either when you have not been taking care of your blood pressure or taking care of your sugar, you begin to find a deterioration in the so-called manhood. Mm-hmm. And those are the things that people should also be aware of. Anytime you begin to have issues with that, you need to go and have discussions with the doctor. Before, men tend to shy away from it. Uh-huh. They don't talk about it a lot. Those are the conversations you should have, because it may be the first sign of the worst things that are to come, or even things that are already existing.
Exactly.
Other things that I always talk about for men is that they have to also drive the family, not just for themselves. They should also drive the family, the wives and others, to go and have checkups depending on what issues that are in the family. The other thing that Dr. Shillingford did not mention, which we don't talk about a lot as men, is the fact that mental health is one of the areas that goes across the spectrum of age and sex. And in our society, and with the fast-paced life that we are living in, it has become a central issue. And the more I look at it, I think, like you mentioned, men should begin to drive it as heads of households to make sure that they become sensitive to some of the factors that they know their family, and they should ask for their children and their spouses to be open whenever they have issues that may relate to mental health, so that they will be dealt with appropriately. And for themselves, they should be able to go to somebody to talk. It doesn't take anything to talk to somebody. There must be somebody, either friend or relative, or you can now walk to the HSA, where we have a lot of persons now that are trained to listen in the mental health unit.
And I think this is one of the things I want to say in the new generation of men, because in the older generation, a lot of us, our fathers were very close knit. They were very quiet. They did not talk about social things with other people outside of maybe the wife or maybe the brother or something. It was a very small knit, and to go to talk to a healthcare professional was almost taboo. I remember distinctively, if you went to talk to someone in the profession, there had to be something ultimately wrong. That was almost a negative sign of the worst case mental scenarios, rather than just, I really need to talk to somebody because I'm having an issue and I want to find the best information to help. That was almost something unheard of until recent years ago. And do you find that you have more open levels for that now with patients coming in, and I say with that more of an open understanding to communication is what I'm saying. Is that something you're seeing now?
I think awareness is the key here. As you told, I'm Dr. Jyoti. As you told, going to the hospital was a taboo before, and now I see that a lot of awareness campaigns. Men's Health Week and PACE Foundation have come up with more talks, awareness campaigns in the churches and in the community. After that, I've seen that awareness has been increased, and we can see the reflection in the investigations, especially about prostate cancer and people getting PSA done. The proportion has been increased over last 10 years at least.
Excellent, and that's what I'm driving towards, that openness, that ability to have that communication, eventually leads to saving lives. That, as you said, early investigation. How important is that to know family history and also have that investigation talk to say, okay, you know what? There was a time that, we had a family member who passed away, but we're sure that they had some sorts of issues, some complications, and that leads to some sort of family investigation.
As Dr. Shillingford told, ailments of prostate and cancers related to prostate are the men-specific events. So talking about prostate cancer, we have a simple test called a PSA, prostate-specific antigen test. That is a diagnostic test for prostate cancer and prostate-related ailments, maybe benign enlargement of the prostate, some trauma or infections. So this should be done whenever it is suspected. So for example, according to the guidelines, this need not be done as a routine test before 40 years. And from 40 to 50 or 55 years, people who have African ancestry and people who have had first degree relatives suffer from prostate cancer, and also people who have high incidence of hereditary malignancies like Lynch syndrome and all, they should start getting tested around 40 to 45 years of age, and this PSA should be repeated every 2 to 3 years till 50 years. Then once at 50 years, every man should get their PSA tested every 2 to 3 years, depending upon the level of PSA.
The time frame is very critical, is what I'm hearing, that men should really be aware from age 40 going up, because those are the times that it is, I guess, more ample to be seen and caught. And eventually, as you said, the information and exploration of it allows you to have that conversation.
Yeah, exactly. So maximum benefit of getting PSA tested is between 50 to 65 years. So before that, people who have had African ancestry and other predisposing factors should be tested. But people who got, according to the research, 50 to 65 years of age, when you get tested PSA regularly, you can bring down the incidence of prostate cancers, especially prostate cancer which are diagnosed at a higher stage, like stage 3 and stage 4. So maximum benefit is from when you get tested between 50 to 65 years.
Exactly. So the test now, how simple is the test for PSA?
Yeah, Dr. Murthy here. PSA test is something which is a simple blood test which can be done in any time. It doesn't need any preparation or anything like that. So it's just a walk-in procedure where the phlebotomist takes a blood sample and the reports will be there within few hours. So this is nothing which has to be prepared or anything to be worked out on. Simple blood test which will show what exactly the prostate status is about. So as Dr. Obinna was telling that nowadays what we think that men should come when they are healthy to the hospital rather than when they are sick, because science has advanced a lot and so is the medical field. We have a lot of investigation, lot of procedures and lot of things which would not have imagined 2 or 3 decades ago. For example, you take imaging. So there are wonderful imaging techniques what we can use these days to identify diseases. It may not be cancer, but it may be other diseases. But Dr. Obinna emphasized on mental health. So people who suffer from Alzheimer's, Parkinson, all other things, so they can be actually diagnosed and treated if they come at the right time, get it diagnosed. And also nowadays screening is something which we emphasize good. So that is something which is done on the normal population rather than the people who are sick. So men has to come to the hospital when they are well and go through the GP checklist. So depending upon the age, their risk factors, there are a lot of screening procedures. So that can be done as well.
Exactly. Folks, we're going to take a first break. You're tuned in to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We're talking about men's health and the pros of it and how you can better yourself just by going in and get tested. We're going to come back and talk about regular diagnosis for testing of colon and prostate, and also some of the tests and to determine the aggressiveness of cancer. We'll be right back in just a few moments.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's General Practice and Public Health Clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to Healthcare Today with the HSA. Thank you so much for tuning in. Each and every Friday and Saturday, we get together and talk about all things related to your health. Compliments to our friends over there at the HSA. And I have with me a panel of gentlemen talking about men's health. Please introduce yourselves to my listeners.
I'm Dr. Murthy, radiologist at HSA.
I'm Dr. Jyoti, pathologist at the HSA.
Dr. Shillingford, a general practitioner working in urgent care at the HSA.
Dr. Eleweanya, I also am a general practitioner working in urgent care of HSA.
And I'm Ernest Jehangir, Dr. Ernest Jehangir, I'm a surgeon at HSA.
So we started off talking about symptoms and screenings and what is really related to men's health and how, being the head of the family, we have to take the initiative to start the procedure and also be consistent with it. Which brings me to my, I want to say, second kind of question, which boils down to testing. We kind of ended talking about the PSA test, which is the men's screening for prostate cancer. But there are some other things that we would like to introduce and also talk about as we relate to men's health and probably the aggressiveness of how it can happen so fast.
Dr. Jehangir here. Now, let's talk about symptoms of prostate cancer and colon cancer. Number one, there aren't any symptoms. Most of the patients who present are presenting late. So when you have symptoms, the cancer has already progressed quite far.
Wow.
So I'll give you an instance that if you see a patient in stage 4 colon cancer, your chances of treatment being a success is less than 5%. Wow. Whereas if you catch it in the early stages, like stage 1 or even what we call stage 0, the cure rate is between 95 to 98%. So
that's a huge difference.
It's a huge difference. It's the headline figure. Catch it early, treat it. Catch it late, not much we can do. So both these cancers, prostate and colon, rely on people coming forward for screening because we want to catch it before it actually gives you symptoms. Because by the time you get symptoms, like take for instance, symptoms from colon cancer could be bleeding in your stools or suddenly developing a long-standing change in your bowel habit, like you suddenly start going 3 times a day for about a month, or just feeling tired. See, these are so general symptoms, a lot of them, and the problem with that is these are late symptoms.
Yeah, we don't notice them.
No, and prostate is even worse. So it'll have absolutely no symptoms while it's in the prostate gland, and slowly it may cause a little blockage to the urine passage. And so you might find yourself getting up at night and going 3-4 times. There might be a little spot of blood in the urine. But then, like all men, they look at it and say, it's nothing.
It'll pass.
It'll pass, yes. Oh, it must be some some rubbish I ate.
I'm tired. I'm working too hard.
Correct.
There's a myriad of excuses that I've heard people say.
Yep, it's the ostrich principle. Put your head in the sand, forget about it, it'll go away. It does not. So, in order to catch the disease early, we want to screen people who are totally asymptomatic. You have no symptoms at all. So, let's talk about colon first. Okay, colon cancer, we screen by doing a colonoscopy, and that's the best way of doing it. And we offer it at age 45. This is based on both the statistics of the Caribbean and also of the Americas. Now, the reason why we want this to do it at 45 is we find that this is a disease that's coming earlier and earlier. About 20 years ago, you would say 60 was the usual age, but now we're seeing younger and younger people with colon cancer.
Wow.
So, what is the process? We see the patient, we examine the patient, and of course, do the finger test. That's one thing that men should be scared of as well.
Right.
Okay. And it's we then would schedule them for a colonoscopy, which is done under sedation, so that you don't feel anything, and more importantly, you don't remember it. So very often patients come back and they look at me and say, "Doc, when are you going to do this?" It was done 15 minutes ago,
Right. Unaware.
Unaware. And they say it's a good sleep. They had slept for 5-10 minutes, and then the procedure takes usually somewhere around 15 to 20 minutes.
Okay.
And what we look for is early signs of colon cancer or any cancer. And also we look for things called polyps, which are like little mushrooms on the inside. Now, these polyps can sit in your colon for many years. And then suddenly one of them decides, I'm going to turn nasty and become a cancer. So if I find a polyp and I remove it, I actually prevent a cancer 10 years down the line.
It takes that long to develop.
It does take that long. That's the process. It takes that long. So while it's making up its mind to become a cancer, it still has no symptoms. So that's the reason why we offer colonoscopy for everybody.
So do you find that, and this is just, as I said, we're having a conversation, folks, if you just joined us. We're talking about men's health all of this month, highlighting it, but it's something that you should be doing all year round, whether you have an uncle, a brother, or whether it's you yourself. You need to go ahead and get tested. You need to have that conversation with your general practitioner. And also, if you're over the age of 40, this is kind of the critical time that we really need to have this conversation. So based on that, what preventative measures can we start talking about? You're talking about doing a colonoscopy. Colonoscopy based on that. But how do we get to that point? What are we looking for? As you said, maybe stool samples, maybe, but there's no symptoms. So should we just do this every 2 years, every year? What we're looking at?
The standard is that we do it once in 10 years.
Okay.
So you do it at 45, next one at 55, 65, 75, and we stop at 80.
Okay.
Colonoscopy. There are other tests we can do. We can do a stool test. Now, a stool test will look for blood. Now, what happens with this is if you get any blood in the stool test, then you have to go for a colonoscopy.
Okay, one leads to another.
Correct.
I was going to talk about, just mentioned prevention. Dr. Shillingford reminded me. The prevention actually starts from your lifestyle, your diet. The colon, for instance, has to do with what goes into your mouth. Mm-hmm. And most of the time when you hear doctors talk to patients about things related to the colon, it comes down to the fact that you should try to make your diet as wholesome as possible. Whole grain, plant-based diet.
Folks, I'm going to pause right there. And we live in the Caribbean, and the belly is probably the hardest thing for people to control. I've seen them stop smoking. I've seen them stop drinking. But to tell them that they need to change the diet, it's almost a fight in the household. How important is that?
It is. Like the gut is where everything happens. What goes in is what eventually determines how it helps your health. So you put in garbage, the chances are that most of the time, what is going to come out at the end of the road is going to be something that will affect your health adversely. So Dr. Jehangir was talking about the colon. We now realize that the colon has microbiome that is actually one of the most important components of the health. They call it the third brain, meaning that it actually determines what happens, not just in terms of the health of the gut itself, but the health of the whole body. So diet is very important. And the diet is for you to eat things that have high fiber and also contain a lot of plants and avoid ultra-processed food. So it is one way to go towards the plant-based diet and whole grain diets that has more fiber. Another thing is to also make sure you avoid those things that are processed.
Folks, I will just add into what the doctors are saying, and I can say for my own self, I stopped using salt, and this I've told this story many times. I've stopped using salt about 17 years ago. If salt is in my house, it's for dyeing clothes or cleaning or something like that, because I found that too much salt is in my food already. And I've tried to not eat processed food, but whenever I'm out or I'm about with friends or whatever and I'm eating out, there's already a lot of high sodium content and other things in the food that we eat. So why are we adding it when we're home? So this is just my little 2 cents. So high fiber is the way to go.
Yes,
it is. And what happens with high fiber? It dilutes all the bad things. So you have processed foods. Now, processed foods have a lot of things which preserve the food, nitrates and nitrites and things like that. That's why processed meat is probably the worst thing. And these carcinogens sit in the oil of this processed meat. So, I'm going to give a brand name, but it's the one that affects everybody. It's spam. You eat spam, you'll be spam.
Okay.
Yeah.
And folks, we're talking, we're having that honest conversation because, we want you to survive. We want you to live. The doctors love you, but they don't need to see you. They are there to help, but you can help yourself also from the beginning, and it makes life a lot better.
I may add, HSA have just in the last few years, everybody who noticed have kind of rebranded themselves and began to pay attention to this preventive part. We're expanding in the districts. For people, we've talked about this before over and over again. There is no reason for anybody not to access healthcare. Preventive healthcare, taking care of yourself. All the districts have clinics, so you don't have to come to Georgetown. Just walk into any district clinic. Go to your general practitioner. If it is something you want to do immediately, you do it. If it is something tests that need to be done, they will give you an appointment on when to come. And all of these tests will be done. And then from there, the screening will begin. And the appropriate specialist, whether it's the prostate, whether it's the colon, you'll be sent to the appropriate specialist for further tests and further investigations and even treatment. So there is no reason for anybody, any man, in Cayman Islands right now not to be able to go and get themselves tested or at least looked after. Age, as we say, is a little important, but from that we are seeing, Dr. Jehangir have just mentioned the fact that we are seeing these things come earlier and earlier. Obesity is very prevalent in our country, and that has been said and known, and research have shown that these are one of the common factors in most of these conditions. So we are seeing all these conditions in younger and younger because of what is going on with our lifestyle. So the point is, if you have it in your family, I personally think that after 30, 35, you should at least walk into the hospital one day.
Have a conversation.
And have a conversation with your doctor.
Exactly. Which brings me to the role of pathology. We're talking about understanding and dealing with the diagnosis of prostate and all. So, Holland, what's the role that pathology plays into it in diagnosing with the men?
So let us again talk about prostate cancer. We use PSA testing. So again, as Dr. Jehangir told, colon cancer may be straightforward in terms of colonoscopy and finding out the polyp-like or finger-like projections and removing out. But in prostate, presently we have only one tool for diagnosis, that's PSA, because most of the cancers, they do develop in the periphery of the prostate and there may not be any symptoms at all. So the PSA measurement can give us a fair idea about whether there is a prostate cancer or prostate related conditions going on, like benign prostatic hypertrophy or any chronic inflammation of the prostate. So we have done a small study a few years ago which has appeared in Cancer and Control research article that says when we measure PSA, and if PSA is below 4 nanogram per mil, we can be sure that there is no prostate malignancy. And even if prostate PSA is high, it can be due to prostate malignancy or it can be due to prostate disease. Then we have to have the serial measurements of PSA over the period of next 5 years every year. If PSA is raising exponentially, then that could be a sign of prostate malignancy. Then we have to go for a digital examination. Then we have to go for prostate biopsy. for the definitive diagnosis. Yeah.
You brought in the digital part of it, and I want to just talk to Dr. Muti about the radiologist part of it. And I know I'm going to pronounce this wrong, but with detection and imaging, I mean, nowadays we talk about the idea of 3D imaging and all of these other things. Technology has really moved forward in that department. Tell me a little bit about HSA and what we have over there and how it relates to us as men.
Yeah, Dr. Murthy again here. Imaging is something which we emphasize as we concentrating on colon and prostate cancer here. Imaging comes in different stages. The first part would be screening. Second part would be the patient who comes with some symptoms to diagnose the disease, and the third part would be to actually confirm the diagnosis. Sometimes we come up with something abnormal, then we can use radiology to diagnose as well and confirm the diagnosis as well. For example, we have something in the prostate, we can do a ultrasound guided prostate biopsy and confirm the diagnosis. So imaging also comes in something where we can do surveillance with the patients who are on treatment to see whether it's completely cured or still something is there left or not. And coming to colon cancer, as Dr. Ernest told, colonoscopy is something which is usually done. So we have something alternate called as CT colonography. It's a similar procedure like colonoscopy, but it's a little different. Here it's not invasive. We inflate air into the rectum and image on CAT scan. So there is not an invasive procedure like colonoscopy where we have to invasively put a tube inside the rectum and see. Here we do just by inflating air and giving some without contrast as well. And the benefits is like when we go for a CT colonoscopy, there is no sedation needed. So the patient may be still lying on table, conscious, alert, and it's a small procedure where the patient can come in, but it needs a bowel preparation as for colonoscopy, and the patient can get it done within 10-15 minutes and walk home, and we can have results immediately as well. Wow. The other benefits is like when it may be a patient choice as well. Some people doesn't want to get a regular colonoscopy done, so those patients can opt for CT colonoscopy. And sometimes what happens is some parts of the colon may not be accessible to colonoscopy as well. In those cases, in complex cases, CT will be definitely beneficial. And when we are doing a CT, actually it adds up the benefit of seeing other organs adjacent to that as well. So in case we are seeing for a colon, by the virtue of a CT scan, we actually see surrounding organs like kidney, liver, and other things as well. So definitely it helps in other things. And patients who have been diagnosed with cancer or something, then again CT colonoscopy can be done where we can actually see whether the cancer has spread to different organs or what is the stage of the cancer as well. And when the diagnosis is made on colon cancer as well, again to stage and to see how the response for treatment is done, that can be done as well. So only the couple of drawbacks what we have is CT is people think of radiation, but with advanced machines now, what we have at HSA is a 128 slice CT. Those are the machines which are very advanced. The radiation is very low. So imagine just taking a flight from here to London and coming back. The amount of radiation what you're exposed to that is similar to what we get on a CT colonogram as well. So the radiation is very minimal. So it has more benefits. It may not be as good as colonoscopy sometimes because if you see a polyp, as Dr. Ernest Jehangir told, so you can just clip it off there and send for biopsy. That possibility is not there with CT colonography. But as I said, there are a lot of benefits based on that as well.
Exactly. Folks, if you're just tuning in, we're talking about men's health. I have all the wonderful doctors with me. We're going to take our final break, and we're going to come back and start wrapping up, talking about treatment. And I'm going to ask the doctors a very serious question. I'm going to save that, and we'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m., we get together and talk about all things relating to your health. Compliments of our friends over there at the HSA. And with me, I have a group of doctors who are all about men's health. Please introduce yourselves one more time for our listening public.
I'm Dr. Murthy, radiologist.
I'm Dr. Jyoti, pathologist at the HSA.
Dr. Shillingford, General Practitioner.
Dr. Obinna Eleweanya, General Practitioner, Urgent Care.
Dr. Ernest Jehangir, surgeon at HSA.
So we were talking about how treatments for things that arise. We're specifically, folks were dialing in talking about prostate and colon cancer in men. But what are some of the treatments that are available if things are necessary and get to that point that you say, okay, you know what, we found this, what is the next step?
Right. I'll start off with colorectal cancer. So if we do find a cancer, there are three methods that we treat this cancer. First, if we find it in the very, very early stages, we can do a colonoscopy and actually remove the polyp with the cancer in it. And in that case, that is the only treatment that is needed. So a colonoscopy can actually cure your cancer. That's number one. If it goes to the next stage, like stage 1, stage 2, and stage 3, then we talk about surgery. We remove that section of the bowel, and we do that the laparoscopic method, which is the keyhole method. And the stay in a hospital can be anywhere between 24 hours to a few weeks, depending on how a patient recovers. But I have sent home patients within 24 hours after surgery, and this is big, major surgery.
Wow.
Subsequently, if we look at the specimens, and Dr. Jyoti will be looking at the pathology of it, and if we find things like lymph nodes or certain areas which are affected by the bowel, then we can add chemotherapy in addition to this. Radiotherapy has a very small role in colorectal cancer, and it's only in certain parts of rectal cancer that we can offer radiotherapy as an adjunct treatment. That means an add-on treatment to surgery. So basically, colon cancer surgery is the main method of treatment.
How fast does it depend on each case individually, or there's a prescribed, like say, okay, we found something and we took a look at it, we sent it to the pathologist, and now how fast does it take to make that decision to go if that route is necessary?
Right. So, we see the patient in the outpatients. Within 2 weeks, we can get the colonoscopy done. and Dr. Jyoti will give us an answer with a biopsy within a week if we ask for urgent, even in a few days. And on basis of that, then we'll ask Dr. Murthy to do the scans. Okay. So we look for the various other organs like the liver and the lungs to see if there's any spread of the tumor, and then we would plan surgery. So by and large, within a month, everything will be sorted.
This is a real team effort by how you're making it. Sounds that everything is played by a specific part and comes to a decision.
It's what we call as the tumor board or the multidisciplinary meeting. We have this every 2 weeks where we discuss every single cancer case that we have on our books. And we make a collective decision. That means it's not one doctor making, but all of us put our heads together and arrive at the best treatment plan we have for the patient. So it is a collaborative process, and I mean, if I'm treating a patient, I might miss a small point here, but my colleague sitting next to me and say, hey, what about this point? Mm-hmm. And because there's so many heads put together, we arrive at a much better treatment plan that we have for a patient instead of having just one person looking after it.
Wow, and this is all happening within the HSA?
Within the HSA.
Okay, so all of the working parts are internally right there. Nothing needs to come from outside. Everything is working right from inside the HSA.
So that's for colon cancer. Now, prostate cancer is a little different because prostate cancer, basically, we'll talk about two types. One, which is very, very slowly growing. It sits there in the prostate for 10, 20, 30 years. And ultimately, when you go to a better place, it sits there. It doesn't do anything. Mm-hmm. That's one type. The other type is the aggressive type, where it starts growing and it starts growing in other parts of the body. Treatment for most prostate cancers is watch and wait, because we know that a lot of the prostate cancer may be the slow type. Now, if it's a slow type, we either just do nothing but do serial scans and serial blood tests, or sometimes we can give a medication which will slow down the growth of the prostate. So that medication can be either as a tablet or an injection given once in 3 months.
Okay.
So that is using hormones to change the way the prostate cancer cells act. Yeah. If it is aggressive, then we talk about surgery and radiotherapy. And depending on the type, there are various protocols that we follow. Mm-hmm. And depending on the type of tumor, depending on where it is, how it is, then we would talk about surgery and radiotherapy.
It's really a case by case.
Case by case. But most cases do not require radiotherapy and surgery.
Okay.
A lot of cases, we manage it either with hormonal injections or sometimes just watch and wait.
Okay.
But that way, we can keep on top of things. If we watch and wait, we can see.
But you have to know it's there.
We have to know it's there. And that's why it's important to come forward for the screening tests.
Excellent.
Now, prostate cancer is the highest in the Caribbean, in the world. It's the highest incidence of prostate cancer. It's higher than the US, it's higher than Western Europe, it's higher than Africa, it's higher than Asia. We really don't know why, but we think that because of the various ethnicities that have come to make up the gene pool of the people in the Caribbean, mm-hmm. It is 3 times that of most other places in the world. So a lot of
three times?
3 times. So a lot of the studies that have done in America and in Western Europe don't apply and shouldn't apply. And that's why there have been quite a few studies done in the various countries in the Caribbean that have shown that this is very high here.
Yeah, it is the most frequently diagnosed cancer in the US as well as in 112 countries. So out of all the cancers, prostate is the most frequently diagnosed cancer. In addition to what Jehangir told, I would like to add, a PSA is a very tricky test. So once we diagnose that person is having a prostate cancer and we look into PSA levels, if the PSA levels are low, and even if the biopsy turned out to be positive, then we'll wait and watch, and we have to do serial evaluation of PSA over the years. If it is raising continuously, then we'll have to go for hormonal treatment, then CT, chemotherapy and radiotherapy. But it all depends on PSA levels and the stage of the cancer.
Good information here. Getting set to wrap up. I said to folks that I had the ultimate question, and this one is for the doctors. I'd like each of them to answer. How can we better ourselves here, men-wise, to live a more fulfilled life? I know it's almost a loaded question, as they would say.
It is a loaded question, but I have always come from fundamental understanding of health. Our health is a whole gamut of everything, from our physical to emotional to mental to social. It's now being included in everything is wholesome. But for us, it is to make sure that we start from the physical health, which is the one all of us know. Mm-hmm. But I advise men to always please be very cognizant of the fact that the emotional and mental health are also important. In fact, again, studies have shown that stress, just stress, is very, very vital. Controlling your stress or stress reduction is very vital in all the treatments we are mentioning today. If you are going through any of them and you are not controlling the stress, it influences the outcome, or at least influences the way that the outcome manifests. Mm-hmm. So not just the physical, we have already talked about that. You have to go to the doctor, have that conversation. The lifestyle is also important. You have to watch your diet, watch what you eat. You have to be physically active. You have to reduce stress like we mentioned. You have to try to please optimize your sleep. We don't talk about that a lot. Mm-hmm. You also need to avoid substances that don't have anything to do with our body. I call them the 3 S's. You just mentioned salt is one of them. Mm-hmm. And then you talk about smoking, which is cigarette smoking. A lot of us smoke. If you do not have any motivation to stop smoking, smoking has been incriminated in almost all of these diseases, from the cancers to all the other cardiovascular diseases we are talking about. Mm-hmm. And then you also need to watch spirit alcohol. I can't mention that. I did not say alcohol. I specifically mentioned spirit alcohol, excessive spirit alcohol. Right. So taking care of ourselves involved the wholesome of affecting and controlling and making sure that we optimize our lifestyle for health.
Very, very good.
But Dr. Obinna and I will agree that we would not like any of the men listening here today to have to see any of these other doctors sitting here today for treatment of anything. Not for testing, but for treatment, which is where we come in as general practitioners. We recommend, as our mothers would say, our grandmothers, an ounce of prevention is always better than a pound of cure. We are here to make sure that people don't get the things that we would send them to see Dr. Jehangir for. So we recommend, most of all, see a doctor. I hear my colleagues here saying that men don't go to the doctor, but men are interested in health, When I get invited to community organizations like churches to speak to men, some of the best questions, the deepest questions, sometimes you find that you can't leave because they have questions they want to ask. But they just don't go to the doctor to ask those questions. Okay. So those who are listening right now, if you are a man, and as a matter of fact, if you're a woman who has a man in your life, Dr. Jehangir just mentioned a few minutes ago that most of the men he see are dragged to his office by the woman. Now, if you have a man in your life, by all means, maybe not drag him. We don't encourage violence, but by all means, encourage the men in your life to go see a primary care physician, a GP, a family physician. Don't wait for something to be wrong. Starting at any age, from the age of 20 and onwards, there are regular routine things that we ought to be checking for to make sure you're not getting a prostate cancer, you're not getting a colon cancer. And we don't want you to wait until you actually have these things. And as Dr. Obinna says, there are many other things that we ought to be checking regularly as well to ensure that all of us, men and women, stay in good health, in optimal health. Many other things that you ought to be discussing and speaking to your doctor about. So really, prevention is what we are most interested in. And we would like to encourage all the men who are listening right now, just make an appointment. Don't try and change your mind. Don't wait too long. Today, call, make an appointment, see a general practitioner, and take it from there so that we can make sure that you remain in good health going forward.
All right.
Yeah. In addition to what Dr. Obinna Shillingford and Dr. Jehangir told, coming out of prostate and colon cancers, I would like to advise all men to spare at least half an hour for you every day and sit in a quiet place, keep all the social media as well as phone away from you, and sit quietly and do meditation. There are a lot of stuff available on YouTube how to meditate, or just observe silence for 15-20 minutes. Research have found out that meditation as well as keeping ourselves calm and cool can bring down many of the parameters to the basic level, like reduction of blood pressure, reduction of high sugar, as well as leveling of the hormones. So at least do this for half an hour. So that's the best advice we can give at the men's health.
I just want to add the same thing what everyone emphasized on. Stay active and come to the doctor immediately.
Exactly.
You are what you eat. So you have to watch what you eat, and that's the most important thing. When I first came to Cayman, I looked at the diet here. Rice and beans, lots of meat and fish, and to top it all with fried plantain. Okay.
Yes. Oxtail, yes.
Oxtail, of course. Anything green would be preferable. To have a balanced diet is great. It's not, cutting out meats and things, that really doesn't matter so much. But what matters is that you dilute it with a lot of fiber, a lot of green things, and to have a balanced diet, and of course, get some exercise.
Exactly.
Are we going to play tennis today?
Excellent. Gentlemen, thank you so much for coming here and enlightening my listeners, and also casting the myth that, men's health is not an issue. Because a lot of people, for many times, it'll pass, it'll be all right. I just have a headache. I'm just, out in the sun too much. Gentlemen, stop making excuses. Please go see. Start with the GP. We have great ones here at the HSA. They're willing to talk to you on any level about anything, so that we don't have to go down that road, and you know which road I'm talking about. Gentlemen, thank you so much.
Thank you.
Thank you.
Excellent. Keep it right here. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll get together each and every Friday and Saturday. Be good to one another. See you soon.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.